morning, everyone! Today, we will be showing you this first aid procedures.
In this video, we will be covering about the explanation of equipments, choking, and bleeding, broken bones or sprains, dressing and bandaging, as well as unconscious with and without breathing.
Explanation of equipment.
So now let us introduce our materials or equipment to be used. First is the betadine. Now the betadine is an antiseptic used for skin disinfection before and after surgery. It may both be used to disinfect the hands of the healthcare providers and the skin of the person they are caring for. It may also be used for minor wounds. So next is the conforming bandages, and these are very stretchy, as their name suggests, conform closely to the body's contours. These bandages are ideal for securing, dressing in places, particularly on the limbs. These bandages are lightweight, fray-resistant, and breathable. These are usually made with synthetic materials. Next is the stero swab, and these are usually absorbent layers and bodily fluids. The absorbent stero swab can be used when managing minor wounds for cleaning, drying, and dressing the wound. So the high quality and absorption of the swab helps to absorb bodily fluids from the surrounding of the area. Next is the rubbing alcohol's claim to fame lies its disinfecting powers. It can kill many bacteria, viruses, and fungi. And the rubbing alcohol you buy at the drugstore is a mixture of isopropyl alcohol and water. Next is the gloves that help you clean your hands and lessen your chance of getting germs that can make you sick. Wear gloves every time you touch blood, bodily fluids, bodily tissues, mucous membranes, or broken skin. Next is biogesic relief form of aches and pains such as headache, backache, menstrual cramps, muscular aches, minor arthritis, pain, toothache, and pain associated with common cold and flu. Now, we have also the plain bandages that all of us know that we use for our wounds, and this is very common, and it is used to just cover very light wounds. It cannot cover those heavy open wounds, so these are only for very minor abrasions and other stuff. Next we have is scissors. These are used to cut open on any other surface or packages, and it makes the job easier, so you use this rather than using your hands to not contaminate any materials or equipment you are going to be using.
Bleeding.
Now, all dancers can bleed through various of things like getting hit by a prop used or tripping down while dancing. Well, these are just the common ones that may result to abrasions and may remove skin. So the first thing to do is stop the flow of the blood. But first, wear gloves to not contaminate the hands of the person or the people you are going to care for. Then cover the wound with a towel or just with the hands. With the gloves, then apply pressure to stop it from the bleeding so much. But if the body part has been amputated, make sure to put it on ice. And while waiting for the medics to arrive, lay your patient down for it to relax, but make sure to hold the arm that is bleeding to give it support.
Dressing and bandaging.
Hi, I'm Ariza, and these are the different techniques of dressing and or bandaging that may be seen mostly during bleeding, such as abrasions or having a fracture that are common injuries in festival dances because of overpowered movements. The first technique to tackle is called square knot. This is the best and most common since prehistoric times, as it's comfortable yet steady with a person's movements. You can use this as a triangular arm sling. So how do you tie a square knot? First is to get any sturdy and soft cloth, like a handkerchief. You can also use it as a cravat, which will be explained later on. Then put the right end over the left, wrapping it under. Then pass the left end over the right, then tuck or wrap it under once again, then pull both of them in a firm manner to finish the bandage. The second technique is named an open face or bandage, which means that all points and ends are expanded or opened from one another. You may see this used as an arm's length, but also can be an underarm, top of the head, on your chest, or either the hand or your foot. An example situation would be a laceration. Moving on. A cravat bandage is another bandaging technique that includes a triangular cloth to be brought into three folds down to its base. There are two ways on how this is commonly used, such as a brogue cravat, which means having it on your abdomen, knee, shoulder, hip, arm, or leg. The other is a narrow cravat, which is used for the forehead, ear, cheek, jaw, and ankle.
Broken bones or sprains.
Broken bones may either be experienced as an open or closed fracture, which means internal or external bleeding. If someone has a fracture, you may see swelling or bruising, difficulty moving, the limb or possibly a ligament looking shorter, twisted, or bent, grating noise or feeling in the limb, loss of strength, or even leading to a shock. Let's get into treating. If you have an open fracture, perform first aid by covering the wound with a sterile dressing and securing the bandage. Apply pressure around the wound, but not over the projecting bone for blood control. Support the injured limb to stop it from moving or making it worse. Place the padding around the injury, and lastly, call your emergency hotline. While waiting, you can secure the area with a sling. A fractured leg can be bandaged with a triangular bandage or cravat. But you still need to keep checking if there are any signs of shock. And lastly, do not elevate the leg.
Unconscious, with and without breathing. If you found someone laying down on the ground and they do not look like that they are resting nor they are sleeping, you will need to check if they are conscious or not. You can raise out your voice and say, "Hello, can you hear me? Are you okay? Hey, can you hear me?" Now, if you've confirmed that they are unconscious, you will need to check if they are breathing or not. This is a very important step. What you will need to do is you can put your face near his or her nose and look at their chest to see if they are breathing. If you've confirmed the breathing, then move the person into their side gently and then call the emergency hotline services. If you found someone laying down on the ground and they do not look like that they are resting nor they are sleeping, you will need to check if they are conscious or not. Hey, are you okay? Hello? Hey. Now, if you've confirmed that they are unconscious, you will need to check if they are breathing or not. Hey, he's not breathing. If you've confirmed that the person is not breathing nor responsive, what you will need to do is immediately call the emergency hotline services. Hello, emergency services. There is someone here in your 23rd Avenue Street. He is not responsive nor is he breathing. Please send an ambulance immediately. Perform the chest compressions until emergency services arrive. And while giving the CPR, you should mimic the counting of 2001, 2002, 2003, 2004. And remember, while performing CPR and while you are in this position, remember, do not bend your arms. They should be completely straight while performing CPR, such as you will see in the video provided. Choking. If you see someone holding their neck like this, the first thing you need to do is ask if they are choking. Are you choking? Try coughing it out. If he or she can't cough it out, what you will need to do is use your hand to support him or her leaning forward, and while your other using the heel of your hand, you will give 5 blows in the back. After giving 5 blows in the back, try to see if the object stuck on the throat is visible to be seen when the mouth is open. If it is seen, ask the person to pick it out. If the object is still stuck and not visible, perform 5 abdominal thrusts. Stand behind the person and link your arms around them, above the belly button and below the chest. After linking your arms, you form a fist, and your other hand supports the fist. And place it. After placing, what you would do next is that you would push sharply inwards and outward.